what are the symptoms? We have the symptoms that have been classically recognized as menopausal. What is not well recognized is that increasing lipids, increasing risk of cardiovascular disease, and brain fog associated with cognitive changes. Every organ system in your body is affected. And so we have dry skin, dry eyes, dry mouth, like everything dries out like a crisp. We have, hair gain in places we don't want it, unwanted hair growth, and hair loss at the same time. We have body odor changes. We have taste changes. We have eyesight changes. We have autoimmune disorders become way more prolific in menopausal women.
Well, hello there, and welcome to this episode of the Terri Cole Show. Wow, I'm so excited for you guys to listen to this interview that I just completed with Dr. Mary Claire Haver. So you might know her as Dr. Mary Claire on Instagram or TikTok. She is an OBGYN and she is a perimenopause and menopause expert. And I gotta say, her work has really helped me lessen my own suffering during menopause. She had created the Galveston Diet and has a book out of the same name, which is basically really shedding light on how to lose weight when you are perimenopausal and postmenopausal, because it's not all the calories in and calories out like we used to think that it was. But we covered all the topics. What is perimenopause? What is menopause? Is hormone replacement therapy safe? Is it healthy for you? What you should and shouldn't do? Different ways to manage menopausal symptoms, but also just health in general. So I really enjoyed interviewing her, and I hope that you guys enjoy it as much as I did. I'm so incredibly excited to welcome Dr. Mary Claire Haver to the Terri Cole Show. Welcome.
Thanks for having me.
Like literally so excited. I'm obsessed with you, and I think a lot of people are with what you put online. We are this generation of women who are super capable. And then menopause happens and you're like, wait, what? Mm-hmm. What is happening in my body? Why does sex hurt? Why is this like this? Then you start looking at all of the things we've been told, or maybe I'm just saying what happened for me. Start looking at all the things I've been told about hormone replacement therapy and about this one friggin' study that was done in like 1968 that from the beginning of getting information from regular doctors, they're like, yeah, hormone replacement therapy is dangerous if you have breast cancer history in your family. And who doesn't at this point? I'm sorry. Right. Is there anyone who doesn't have breast cancer history somewhere? And so I love your straightforward, down to earth, easily digestible, easy to understand voice of expertise in this field that we so desperately need. So I'm not going to give any of the answers that I found because I want you to give us all of the answers that you found. So can we start with what inspired you to become a perimenopause and menopause warrior? I know you're an OBGYN, you've got your background, but why this in particular when you could have focused on anything?
I was a generalist for a long time, meaning I did OBGYN, but I did not do a fellowship in reproductive endocrinology or GYN oncology or any of the recognized fellowships. And when you get out of training, what tends to happen, at least in my generation, was you're young and you're bringing in new patients, and usually in pregnancy or young patients looking to start, GYN care, thinking about getting pregnant, whatever. So here I was pregnant, having babies with my patients. We're all like delivering at the same hospital. And then we all start aging together. And I started noticing a trend of weight gain and unexplained weight gain. And these are women that I worked out with. These are women that I lived in a small town and I was the town gynecologist. And, I went to the grocery store. I was moms at the school, at soccer games, whatever. And so this kind of trend of this unexplained weight gain starting somewhere in their late 30s, early 40s. And the only thing I'd ever been taught was, well, it's their fault because they're eating too much and not working out enough. And we tend to overestimate our calories and underestimate how much we move. So that's what I would tell them. Work out more, eat less. You have to focus a little bit harder. Maybe our metabolism slowing down, blah, 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 blah. And then I started going through menopause and it happened to me. And where I had enjoyed for years this
Mhm.
kind of, thinnish figure and thought I was healthy based on my body shape. And, then I started getting this unexplained kind of middle pouch thing. And my brother had passed away and I'd gone through some
Mhm.
depression associated with that and kind of fell off the
Right.
wagon nutritionally and wasn't working out from depression. And so I thought, okay,
Mhm.
that's why I was
Yep.
gaining weight and probably had a lot to do with it, but I couldn't get it off. Like once the depression lifted, I realized that some of the
Right.
symptoms I was having, I was attributing to my depression were actually probably perimenopausal. And I was doing everything I was taught to get the weight off, doubling down at the gym, calorically restricting to dangerous levels, and it wasn't coming off. So that kind of began my what's going on. That was, and it's embarrassing that I wish I would have said something more elegant of, oh, my patients were suffering with unexplained joint pain and hot flashes and skin and, all the other organ systems. Nope. It was vanity. I
Mhm.
didn't like the way I was looking in my jeans. And
I feel you.
so but it brought me to like call the nutrition department and say, what's going on with women in menopause? Why is this uniform belly fat deposition happening? And they're the ones that started handing me research articles on visceral fat and menopause and inflammation and how they're connected. And I just was like, whoa, 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 no one ever taught me this. I knew that I was deficient in nutrition education. They don't teach us anything in medical school, or they didn't at the time. And I
Mhm.
had learned nothing in my residency about that. And I just started recognizing how important nutrition was as we aged and really understanding things outside of just calories in, calories out, or like severe protein malnutrition or kwashiorkor or rickets and those kind of things. So I enrolled at Tulane University in a program for nutrition for healthcare providers called culinary medicine. It really just blew my world off, because it was everything I didn't know about real nutrition, how it affects the body, how we can use it medicinally, etc. So then I was making these like, okay, well, no one's talking about menopause here. So I'm making connections on my own. So I'm in my mind, I'm developing this little program for me. I start experimenting with fasting, not so much for weight loss, but for the anti-inflammatory benefits. I start looking at the Mediterranean diet and other anti-inflammatory nutrition kind of programs. And I'm like, this doesn't adapt well. This doesn't play well in the US. It's hard to like find the fresh fish. And so I created this program for myself and my patients called Galveston Diet and started talking about it more and more online. And my social media presence was growing, but I was always looping in the menopause part of it, like what happens when our estrogen levels decline. And that just kind of exploded online for me. And people wanted to learn more and more about
Mhm.
menopause in general. So I'm reading the latest studies and realizing how much of the WHI had been walked back, and how much of it had been blown out of proportion, the media kind of, frenzy over that information, and how much of it was basically misinformation. And how we were scared to death to give hormone replacement therapy in practice because of this one study. And it really changed changed the health outcomes for a whole generation of women. And I was like, oh my God. So I started talking about that on social media, and then like the world flipped over on its end. And here we are today. But good news, I'm writing a new menopause book, not just about
Yay.
lifestyle and nutrition, which was what the Galveston diet was, but on all aspects, looking at the symptoms no one was talking about, like the musculoskeletal joint pain and some of the skin, the vertigo and the dementia and the Alzheimer's and the brain fog and and how it's all interconnected, and what can we do both hormonally, non-hormonally, nutritionally, exercise to help us stay as healthy as possible through our menopause.
What's so amazing about the fact that you're doing that is that it's so needed, but what's so interesting is that the response that you got on social media and that you're still getting is so indicative. It just the proof, the evidence of what we need is in those numbers, is in that behavior, is in us looking for someone to guide us through this time in a way that we're really in some respects, we're the first generation of women who have less shame, right, about this. I couldn't not talk about
Right.
it.
Aging.
Right. About aging. I mean, listen, sir, I'm not saying there's not pressure to look young and all of that stuff, but because we're one of the first generations that was allowed to accomplish, like we're accomplished, we had more choices, right, than people coming up when, you start working in the 70s and it's like, you can be a teacher, you can be a nurse, you can be a secretary. These are the three things you're allowed to be. So think about age-wise, if you're in your 50s or 50s and 60s, you're sort of the first generation that was able to choose something else, right? So you chose to be a doctor, I chose to be a therapist. And so there's a certain amount of empowerment we've had in our lives, and then privilege, because we're both white women. So there's a certain amount of privilege that we've also experienced. So taking menopause, like laying down and having some male doctor tell me, that's just how it is like, no, that is not. I mean, I don't even
You
have
can't
male
live your
doctor,
best
but
life. You're going to suffer.
yes,
Yeah. Yeah.
exactly.
So what has astounded me, one of the things that astounds me, speaking of privilege, is that I am hearing the same questions, the same complaints, the same story from every walk of life. If the woman's lucky enough to get in front of a doctor, which not everyone has that privilege, right?
Yep.
And to talk about her symptoms, I have been befriended, messaged, DM'd, emailed, come to my clinic in Texas from some of the most influential, famous people. I can't even believe it still to this day, who have all had the same experience. They cannot find someone to listen to them, to recognize that what they're going through is happening. And it's not just that they're stressed out or it's this time of your life, you're just getting older. There's so much opportunity here.
Yep.
We don't have to suffer. That's not necessary. You can thrive in menopause and live this beautiful life free from, no one's going to be free from pain or free from, but what shocks me is that we were functioning human beings, living our best life, dealing with our stress, dealing with life, dealing with whatever was, we had it covered. And the only thing that changed in our lives were our hormones. And then we lost that resilience. We lost that ability to handle those things.
Yeah. It's interesting that we're talking about really well-known and super famous people. I mean, Oprah has been very vocal in her experience of being misdiagnosed with heart stuff, all of this. And she's also being like,
5 times.
5 times. How is this possible? And yet it is. And if this is happening to people with the most amount of reach, the most amount of money, the most amount of privilege, it really just speaks to obviously how desperate we are for the right information, because especially the women in my crew are super coachable, right? Very smart, do research, but coachable. So it's like, if we just got to find the right person, I feel like you're certainly one of those people that we've all decided is someone that we can trust, partly because everything is so well documented that you're always sharing the studies, which I love. And I always go and look at it. I'm a well-informed person, personally, but I don't really have the knowledge to find the studies in the same way that you do. So I find it so much faster and easier to do it that way. So let's dig in a little bit, if we can, for people who are, because my audience is all different ages, but lots and lots of people, perimenopause and menopause. So can you just talk a little bit about those two experiences, when they happen, and some of the things that we experience when they're happening?
Sure. So we have premenopause, which is your body is not registering any effects of declining estrogen levels. Okay. Menopause is a medical term, and it means it's just one day in your life. It is defined as 1 year after your last menstrual period. But what it represents for all of us is that there is no longer going to be any ovarian production of estradiol, or just less than 1%, minimal, or progesterone. Okay. There's a little bit of testosterone that still happens in a menopausal woman. So the major sex hormones have gone into massive decline, and you will not ovulate or get pregnant again. That is 1 day in your life. Everything past that point is postmenopause. Okay. Perimenopause is where you go from rocking your world. Everything's fine. You're having normal monthly periods. If you have those, not everybody does, and then it's the transition, and it's not overnight, from normal reproductive function to menopause. That is perimenopause, and it takes somewhere 7 to 10 years. So Typically, the closer we get to our actual menopause, the worse the symptoms are. Now, what are the symptoms? Well, we have the symptoms that have been classically recognized as menopausal, and then we have symptoms that we're just now discovering actually have a very large menopause component. So traditional menopausal symptoms, we all pretty much know: hot flashes, the accompanying night sweats, the sleep disruption, the genital urinary changes like vaginal dryness, painful intercourse, recurrent UTIs, osteoporosis increasing. What is not well recognized is that increasing lipids, increasing risk of cardiovascular disease, brain fog associated with cognitive changes. I'm going through organ systems, right? Mm-hmm. So there are lung changes, there are liver changes, there are stomach changes, every organ system in your body is affected. And so we have dry skin, dry eyes, dry mouth, like everything dries out like a crisp. We have, hair gain in places we don't want it, unwanted hair growth, and hair loss at the same time. We have body odor changes. We have taste changes. We have eyesight changes. We have autoimmune disorders become way more prolific in menopausal women. So all of these things, even taking aging out, are independent risk factors associated with the menopause. The decline of estrogen actually accelerates these disease states. And it begins in perimenopause.
Yeah, I used to always want it. Once this started for me and I realized how friggin' long it was going to go on, I was like, I want to write a book about this it shouldn't be called menopause. It should be called Meno Marathon, because it's like this shit never ends. So let's talk about natural. You talk a lot about natural ways to manage symptoms. So let's talk a little bit about that, shall we?
Sure. So how you show up health-wise in your perimenopause is how basically your body's going to react to the estrogen deprivation. And the healthier you are, the less likely you are to have severe symptoms. Now, you can have the healthiest woman in the world who has life-debilitating symptoms. So there's no guarantee. But there are ways outside of hormone therapy and we kind of have to look at it on a symptom by symptom basis. What kind of helps everyone? So if you're talking about hot flashes, there are certain products, foods, supplements that are phytoestrogens, meaning they have estrogen-like capabilities chemically within the body. Soy is a really famous example of this, that they tend to weakly bind to the estrogen receptor. And for some women, they may find that some of their symptoms get better. Ashwagandha is another one. Black cohosh is another one. But it really is kind of a trial and error basis, because it doesn't work for every woman, depending on the severity of her symptoms. Yeah. So when we're looking at fiber intake, that's a big one. A lot of women don't think about. Women who have more than 25 grams of fiber intake in their diet per day, and hopefully it's from food and not just supplementation, tend to have less severe symptoms. They also have less visceral fat, less cardiovascular disease, less autoimmune disease. All of this stuff kind of feeds into each other. It lowers your inflammation, which makes everything better. Interesting thing about hot flashes, a lot of people don't know, the more severe your symptoms, the more likely you are to have Alzheimer's, dementia, and cardiovascular disease. Wow. So if you're a super flasher, untreated, you're at higher risk. And the longer your body is without estrogen, the higher your risk. So that kind of on the flip side means the younger you are when you go through menopause and start having symptoms, the more likely you are later in life to develop these disease states.
Interesting. Is there any truth? Someone asked online, I said that I was going to be talking to my favorite menopause doctor. And I said, what do you want to know? And one person said, does someone who has never had a pregnancy, is it possible that you go into perimenopause or menopause earlier?
So it's a very small percentage. When we look at things that affect our natural age of menopause, I'm not talking about surgery and chemotherapy and all those things. Smoking is one. But, so you have twins and the natural age of menopause. Genetic is one. So if your mother, if your sisters, went through menopause earlier than, and your grandmother on your father's side, the more likely you are to have an earlier menopause as well. Exposure to certain environmental things, of course, radiation, that can have an effect. Smoking has an effect. If you are underweight, so if you've been really, really thin your whole life, you are more likely to have an earlier menopause. If you've had a hysterectomy, but your ovaries were left behind, it's probably to do with the inflammatory changes associated with healing post-op, as well as a small amount of blood flow to the ovary. You tend to lose about a year or two off of your menopause. If you are an Asian woman, you tend to go later than Caucasian, and then Black and Hispanic women tend to be a little bit younger. So there's a lot of things that kind of feed into when we go through menopause.
Wow. So what a lot of people want to know about, which is exactly what inspired you to do the Galveston Diet, is how do we deal with, I mean, I'm not sure I even care about the why of the weight gain. Like, okay, fine. Like we know it happens, but really how to manage it best. Because just like you, many of us heard from doctors, work out more, calories in, calories out, all that stuff. And that doesn't work not for everyone when you're going through menopause.
Right. And not in a healthy way, right? Not in a sustainable way. If I tied you up and starved you, you would lose weight. That's calories in. But that's not, how do we do this in a healthy, sustainable way that is not going to wreck our metabolism or cause us tremendous amounts of muscle mass loss? Stop focusing on the number on the scale. Like, how do we lose fat, right? So at least visceral fat, there's some great evidence-based ways to do it. One is, like I had mentioned it before, 25 grams of fiber per day. Women who do that consistently with food will see less visceral fat deposition than women who don't. Limiting the added sugars to less than 25 grams per day. So not saying you can never have a cookie or a sweet or put sugar in your coffee, but you have a budget. And women who budget their 25 grams and keep that on a fairly regular basis, less than 25 grams per day, do way better in this situation. Probiotics have been shown to be helpful. And this is one where the studies were actually done on supplements. There's some great sources of probiotic in food. And I really think we should try to get our, probiotics naturally. Yogurt, kimchi, miso, lots of, Chinese pickles, lots of fermented foods have lots of probiotics naturally in them. But there are some decent supplements, and the studies have shown that in a menopausal woman, not only did it help with blood pressure, it helped with visceral fat, belly fat as well. Zone 2 training. So exercise is important. And we at this age should be doing cardio for our heart, right? And our brain, and our health, and also the resistance training, strength for both as well. Strength for our muscles to stay strong. There is, our bodies with aging try to shed muscle as we get older. It's a process called sarcopenia. And also when we lose our estrogen levels, we lose some of the androgens, we see that happening, that accelerate. And that muscle mass is what determines your resilience against diabetes, your resilience against osteoporosis, your resilience against functional decline as we get older. I'm 55. I don't know how old you are, but I'm less concerned about rocking a bikini at this age. I don't want my kids to be having to take care of me for the last 10 years of my life. I don't expect to live forever, but I don't want those last 10 years to be my children burdened with my health care. Yes. And so are worried about me or fighting over who's going to go take care of mama because she can't get out of bed or she can't lift this or she can't or think. And so the things I'm putting in place right now are going to determine that in the next 20 to 30 years.
Absolutely.
And that's how I think about health and nutrition now, and not so much about not being fat. Visceral fat is a sign of inflammation.
Okay, so let's talk about, and this will bring us to the Galveston Diet that you created, and this is what your book's about, your first book, because I know that you share basically the things that, the 5 things that you do every single day. So just walk us through, if someone's listening, like, I need to make some changes. I don't know that I can make all the changes, but like, what is most important?
Sure. So my top tips would be, consider fasting. Again, if it triggers an eating disorder, it's not for you. You can be healthy without fasting. But there is something to that time without food that puts just enough stress on your bodies and on the cellular matrix so that your body has to fight a little bit harder to become more resilient. And it's almost like working out for your muscles. And so the studies that I really like were done with a 16-8, which is 16 hours of fasting and 8-hour eating window. Now, do you have to do 16 every day? No. There's multiple ways to do fasting. I just kind of caution against some of the routinely extreme fasting, because once you fast and everybody has a different threshold, when you get to a certain point, your body will shift from burning fat to burning muscle for fuel to get the amino acids.
Right.
And when you do that, you're losing muscle.
Right.
And so that's called starvation. That is the definition of starvation.
Mm-hmm.
And so you want to fast, but not starve.
Right.
And, for you, that may be 14 hours or 15 or 16 or maybe 17. But once you get past 18, it's a little bit hard to not sacrifice some of that muscle to get those gains. And then it's harder in those tinier windows to get enough protein to stay healthy. So consider fasting. Number 2, make sure you're getting enough protein. Typically, women in the U.S. are only getting about half. There are good things that came out of the WHI, and I want to stress that, the Women's Health Initiative. And one of them was looking at the healthier population, less osteoporosis, less visceral fat. They had 1.6 grams of protein per kilogram of body mass. So that's somewhere around 100, 120 sometimes, for depending on, where you are. And women are getting 50, 60, 70, and actually the FDA is only recommending 0.8. Half of what the studies are showing for a menopausal woman you should be getting. So really focusing protein-centric meals, limiting those added sugars, really watching the added sugars to less than 25 grams per day, making sure you're getting 25 grams of protein. And when you're setting up your time for exercise, making sure that you're doing enough resistance training 2 to 3 days a week, a push day, a pull day, and a leg day, so that you're really hitting all the major muscle groups and doing progressive load, meaning every day you're trying to be a little bit stronger or do a little bit more. So you're forcing your muscles to get stronger, but not leaving out the cardio. Zone 2 is not super strenuous. It is a zone of the heart rate. And you can Google what zone 2 is. It takes too long to explain here. But it's the with you're just about breathless. You can talk, but it's kind of hard. So that's that's an easy way to figure out what your zone 2 is. And spending about 150 minutes a week in zone 2 training. And finally, making sure you're doing the work of self-care, whatever that looks like for you. Meditation, journaling, reflection, calling your girlfriend, hanging out with your mom, prayer. I don't care what it is, but you're carving out time where you're taking care of yourself and whatever those needs are, so that your cortisol levels come down.
Yeah. So belonging is important. The protein is important. The working out is important. So you also talk about turmeric on your Instagram, and you guys listening, you're interested in what Dr. Mary Claire has to say. She's so incredibly generous. Follow her on Instagram, buy her book, go get involved. Because here's the thing, for people who say they want to make the change and it can be overwhelming, I promise you that, and she's just on Instagram, she's just at Dr. Mary Claire, that's CLAIRE, or at the Galveston.diet. And we'll put all this in the show notes. But I'm just saying, it's something that I feel like you do a service by sharing so much that you share for free. So if someone is suffering, just go to her Instagram and you will find things that will help you. But let's talk about turmeric.
Turmeric. So turmeric, I don't recommend for everyone. It is one of the supplements that we do sell. And it is great for hot flashes. So it is one of the natural ways there's some pretty good evidence to show that it can be helpful for hot flashes. It's also a really powerful antioxidant, anti-inflammatory component. And so, but it needs to be combined with black pepper, the piperine extract, to increase the absorption. It's something that's in its natural form is not really readily bioavailable, meaning you have to eat a lot of it to get enough absorbed in your system to see a difference. And so the addition of the piperine kind of helps get that, through the colon and into your bloodstream. Studies have shown it helps with visceral fat as well. So probably about half of my patients are on turmeric for one reason, and joint pain. So, that anti-inflammatory component is really, really powerful.
Amazing. So for getting into zone 2, so my main exercise that I do, I walk, I lift weights, I do a bunch of stuff, but my main cardio is a mini trampoline or a rebounder that I do.
Oh, I love it. So good for osteoporosis.
Right?
Yeah, that vibratory. Yeah. So another person, some great other people to follow. Vonda Wright is a orthopedic surgeon, and she just, her main business is taking care of us. And so she's got so much information on musculoskeletal pain, joint pain, osteoporosis, fractures, how to avoid them, what to do. She's amazing. Dr. Corinne Min, she's Dr. Min, OBGYN. She is a breast cancer survivor. She was diagnosed, I think, at 28 in her OB-GYN residency she was a very young survivor of breast cancer. And she is a walking encyclopedia of every study to do with safety of HRT and breast cancer and, things that we've kind of been taught. No, you can't do it. It's too risky. Mm-hmm. She is on HRT. And she's a breast cancer survivor and absolutely knows the data. So if that's ever a concern, I would absolutely follow her to get the real information.
Great.
And then Heather Hirsch is another great provider. There's so many. Oh my God. For sexual anything, Kelly Casperson, she's amazing. If you're suffering from hypoactive sexual desire disorder, she's a urologist. She has devoted her life to female pelvic health and sexual function. She's where I learned everything. I didn't learn anything in residency about it. Nothing.
Right.
And I learned it all from Kelly and her book. So these are my friends. These are the people I like to help spread their message because I can't do it all. And they're just so much more powerful than me in certain areas.
Well, we'll include all of those handles in the show notes. Besides, you following Dr. Mary Claire, we'll give everyone else because there's lots of other information out there. I want to ask you a question. This is for you. And I ask almost everyone who comes on. It's about boundaries because, of course, that's my obsession. So personally, what has been your most challenging boundary struggle and how did you overcome it if you have?
My mother, I love her, but that was a boundary I absolutely had to put up in order for my own mental health. I didn't get that mom. She's a wonderful person in so many ways, but I've never felt worse about myself as a human being than when I allow her struggles in her life to reflect on me. And it took a lot of therapy for me to realize that is more about her and her life and her choices and my siblings than it is about me and my life. And learning how to love her with a boundary has been the most powerful thing I've ever done. And it really took menopause for me to realize I cannot take on her struggles. I have my own life to deal with and my own choices. So, that's one.
That is amazing because that can be one of the hardest ones to create is boundaries with a maternal impactor, as I call them, because it could be an aunt, it could be a foster mom. And being able to do it. And I think it's interesting that you say it took menopause, like the sort of level of losing our minds in menopause to just be like this people pleasing stuff. I don't have the bandwidth. At least that was part of my experience where I was like, I cannot worry. I have to let the chips fall where they may, especially when they're not my effing chips. Like I have to stop doing all of this overfunctioning and overgiving and overdoing because really it's really all about over controlling other people. And what a relief when you're like, oh, this is what I need to do for me. Wow. I'm so much happier.
And I think I love her more because I'm not so angry all the time. And I also can step back. She lost my dad a couple of years ago, and it's been deteriorating since then. And that I actually love her more because I can step back and not get sucked into all the drama and just appreciate her for who she is and not be a part of the negativity.
Exactly. I love it. All right. So what is next for you? You're writing a book right now?
Right. So finishing up this manuscript and getting it turned in and just, I'm so research driven and oriented and I'm so I hold myself to such a standard that anything that comes out of my
Mhm.
mouth, I know people are watching and listening, and I must make sure that there's evidence. So there's a lot of research that's going into this
Yeah.
book. And we've been in Colorado writing all summer. And so I'll be heading back this week, actually, back to Texas. I can't wait to go back to my clinic and see my patients because I really took the summer off and see my kids. You know, I have a daughter in medical school and one in college. So
Mhm.
we've been absent for 2 months. And I haven't gone this long without seeing my kids. But it's been really great for my husband and I to, you know, we've launched our birds, and we don't want to call it empty nesting. So
No.
have this time together to focus on each other while I've been
Right.
writing. But I am looking forward to getting home and back to my girlfriends and my routine.
Yeah, life. Okay, so where can people who are massively interested in what you're doing, where can they find you?
Sure. So our website at this moment is galvestondiet.com. We're undergoing a rebrand. It will be the Pause Life soon, but you'll be redirected if you look up Galveston Diet. And we're on Instagram and TikTok at Dr. Mary Claire, and on Facebook and YouTube as the Galveston Diet.
Well, I just want to say thank you so much for spending so much time with us today, answering our questions, but also for what you're doing, because I know you know this. I think you know this, but you're really making a difference in the quality of our lives. You really are. So what you're doing is so important. And I want to encourage everyone who's watching this on YouTube or listening to this podcast. You don't have to suffer. There is data-driven research with a compassionate MD who is happy right here. Here she is, Dr. Mary Claire Haber, to help you. So I just want to say thank you because you have really helped me. And I just appreciate the work that you do and the high level of quality and the fact that you care the way that you do. So thank you, thank you, thank you.
You're so welcome.